Good afternoon and welcome to you. This study of almost 8,000 health workers makes clear, does it not, that the pandemic has weighed on them very heavily?
Absolutely. The stories that we just heard are not just anecdotes. Our study really confirms that healthcare workers across Australia have suffered during the pandemic.
Were the respondents from around the country, all based in regions where COVID case numbers were particularly high?
So most of the respondents to the survey came from Victoria, and at the time the survey was done, we were in pretty strict lockdown conditions here. And I think in part that's reflected in some of our findings. So we found that 1 in 10 healthcare workers reported thoughts of suicide or self-harm in the 2 weeks before the study. Healthcare workers who were living alone were particularly likely to be having thoughts of suicide or self-harm.
And the findings also revealed that healthcare workers don't always think of looking after themselves in these circumstances. They didn't necessarily seek support for their mental health.
That's right. So one of the most shocking findings from our study was that fewer than half of the healthcare workers who had thoughts of suicide or self-harm, fewer than half sought professional help for that. Some people provided us with free text explanations. Some of them said that they knew that they needed help, but they were so exhausted at the end of a day in the hospital that trying to get help for their own mental health just felt like another thing on their to-do list, that they were too exhausted to even reach out for help.
Do the findings reveal more about the types of health professionals who experience thoughts of suicide or self-harm?
They did. So we found that, for example, doctors who were exposed to the risk of infection, and particularly those who were worried that their family members or loved ones might contract COVID through their job, were particularly at risk. We saw that younger healthcare workers were at higher risk of thoughts of suicide or self-harm, as were those who were living alone. There were some other risk factors that we also identified. So healthcare workers who had struggled to maintain social connections during the pandemic were also at higher risk.
What do you think the implications are of this research, and who should be taking note of the findings?
So I was working in a hospital while I was doing this research, and as the results came in, it just gave me chills down my spine. I would walk around the hospital and look at the people walking past me in the corridors and think, you know, you're all there with a smile on your face, doing your job, caring for patients, and yet 1 in 10 of you is having thoughts that life's not worth living or thoughts of harming yourself. So I think this is a tremendous wake-up call for Australia, that we need to do a better job of caring for the people who have been caring for us throughout the pandemic.
Would you say it's a wake-up call for specific health departments to provide health workers with information about looking after their own mental health while they're taking care of others' physical well-being?
Absolutely. So access to appropriate healthcare services for health practitioners is so important. They need to be available at the times when health practitioners can access them and really understand the realities of what the job involves. But I think we also need to do much more to address the workplace stress that people are experiencing. For many of these healthcare workers, the pandemic really widened pre-existing cracks in the healthcare system, so that we know that problems with understaffing, unstable shifts for casual workers, neglect of the aged care system, these are all pre-existing problems that have worsened during the pandemic. I don't think it's enough to just offer more healthcare to the health practitioners. We really need to be addressing those underlying problems that are causing this tremendous stress on them.
Thank you for explaining your research to us. Professor Marie Bismarck, a public health physician and health lawyer. Good to speak to you.
Thank you.
And if you need information or support, you can contact Beyond Blue on 1300 224636. That is 1300 224636. Or if you or someone you know is experiencing distress, please contact Lifeline on 13 11 14.